My name is Ulrich Sack. I'm working at the Leipzig University. I'm responsible for cellular immune diagnostics. Our main topic are cellular tests, flow cytometry, cell culture tests for clinical studies and for treatment of patients suffering from autoimmune diseases or with cancer. You know, immune oncology is a very hot topic today, so this is my daily business. But besides this, I'm very interested in quality assurance, and that's why I'm active also in INSTANT. So INSTANT is an international, globally active, independent and non-profit medical society. It's based in Germany, but it delivers schemes all over Europe and also to other countries. And it's a society, so it has more than 300 members. Most of them are specialists in medical diagnostics and support the schemes. So we guarantee a very high scientific quality and a very quick reporting of the results of the schemes. And we are working also a bit in the experimental way that we try to deliver novel schemes. And this is what we have done here for the Basophil Activation Test.
Thank you, Professor Sack. I'm introducing also myself very shortly. I'm Michele Romano. I'm the product manager of the cellular allergy test in BÜHLMANN. And today is really a pleasure to hear directly from you some more insights on the establishment of this first external quality assurance for Basophil Activation Test. I'm in the field since many years, and to me, as I think to all the people that are in the field, to have this launch of the first EQA in the BAC test is really a pillar in the recognition of the assay as a diagnostic test, as an effective diagnostic test in the allergy field. My first question is why INSTANT was interested in launching the assay in the EQA for the BAT?
Now, as you already told, the Basophil activation test has become an integral part of routine diagnostics in allergy. And there are very good ways for internal quality control. We have negative and positive controls. This is not an issue, but there was no offering for an external quality assessment scheme until now. And INSTANT is a scheme provider and dedicated to close the gaps in these EQA offerings, and that's why we started it.
Okay, can you quickly explain how the EQA scheme works?
The scheme works very easy. We send out fresh blood. It's not stabilized blood. It's simply the blood sample as a laboratory gets it normally from the patient. So we try to send out schemes that's similar patient samples. So we send out 2.6 milliliter of a non-stabilized EDTA blood to each participating laboratory. This is sent out in insulated boxes by mail, and we decided to use samples of voluntary donors responsible to very stable allergens, and so it's possible to analyze these samples within 3 days after blood collection. And we made no difference between ELISA-based or flow cytometric Basophil activation tests. It's the same, and both groups of users can participate in this scheme.
Okay. Can you explain us how do you set up the EQA?
We set it up very similar to the condition in a clinical setting. We get samples from voluntary donors, and they have a cellular reactivity to hymenoptera toxins. And these laboratories then culture the blood cells inside the laboratory as they do it for the patient samples. The cell activation itself is dependent on the applied IVD test kit. The results then are entered into an internet form, and after receipt of the test results, they are accordingly analyzed and evaluated by Instant according to the rules of the ISO.
Okay, I've seen the results, and I'm very excited about it. Can you tell us also what are the first results of the first rounds of the EQUA?
We completed until now 3 rounds of this test. We started with 14 laboratories. Last round, 25 laboratories participated. And in each series, over 92% of the laboratories reported correct results. So the last sent out from May 2020 showed 96% accurate results from the laboratories. This was a superior performance for such a scheme.
Oh, that's super interesting. Professor Sack, in the basophil activation field, the main concern is, basophils are live cells that are not stable, that can degrade or in any case be under, I would say, not really live when you take the blood. So they see some problem or potential issue in shipping cells. When establishing the EQUA, can you tell us which is your feedback on this?
The feedback from the laboratories is very well. There is one open point still. Some laboratories prefer heparinized blood, but in the beginning we compared EDTA blood and heparinized blood, and EDTA is more stable in our hands. We have not yet a good solution to send out heparinized blood, so we decided to send out exclusively EDTA, anticoagulated blood. And when we send out Hymenoptera toxin reactive samples, this is stable for up to 3 days. And we have a good partnership with Society of Biotechnological Diagnostics in Berlin, and they ensure sufficient blood donations from voluntary donors every time, so we can send out such reactive samples to the laboratories. So the feedback was very, very good. It was a challenge to find out the correct sample type, but we can send it out now in temperature insulated containers, and this makes it very easy to handle for the laboratories.
Oh, that's great. I have just one last question, and of course, if you have any further comments, you are free to tell us. My last question is, which is the impact of the implementation of the scheme in BAT for the allergy patient, of course, and the healthcare professionals?
Now, a long time it was really an open question whether basophil activation tests can be inside the scope of accredited labs, because for accreditation we require a diagnostic value, internal quality control, an external quality control, and a validation. And by sending out this scheme, we now provide a tool to the laboratory that they can do a really well-working external quality assessment scheme accredited by the norms, by the ISO for scheme providers, and can improve the quality of the routine diagnostics. Furthermore, it's also very important that some colleagues have been a bit skeptical according basophil activation tests about reproducibility and diagnostic value of these tests. And we can underline with this scheme that this is really an objective test. It can be reproduced, it can be quality assured, and I feel this improves diagnostics for our patients.
Okay, thank you again for all this explanation, and of course also for the for all the work that you did in launching the assay.
Thank you. It was a pleasure.